Hello, I am Julie Jones Corbett, MS-OTR-CHT, creator of the Corbett Targeted Coin Test. Welcome to my video titled In-Hand Manipulation Tests, Translation Lost. I will do my best in this video to define and demonstrate the classic components of Exner's classification of in-hand manipulation skills. I will make distinction between hand function tests and dexterity tests for meaningful clinical assessment. I will identify the familiar motor components of the three essential in-hand manipulation skills, and I will provide an infographic which compares characteristics of available dexterity or in-hand manipulation tests from 6 published articles over the past 13 years. A flowchart is downloadable, and I will walk through it with you to enhance your ability to integrate the Corbett Targeted Coin Test into your clinic setting with specific populations. My intention is to highlight the dexterity tests that are favored and considered performance-based outcome measures of dexterity. I also want to highlight the value of hand therapy specialist intervention. There are considerations beyond psychometrics where we will explore. In addition to an overview of the Corbett Targeted Coin Test and its clinical value, your takeaway may be to reinforce the importance of reporting recovery of specific in-hand manipulation characteristics and other meaningful terminology in your documentation. I want to reinforce your understanding that the quality of performance in activities considered essential for successful performance of tasks of daily living, work, school, play, and leisure is determined to a large degree by dexterity, which is a subset of hand function. Therefore, dexterity needs its own standardized test assessment. Dexterity, loosely defined as the complex skill involved in performing a manipulation task between finger and thumb pads. Manual dexterity, which is the ability to grasp and release by palm contact within the palm and hand. Fine motor dexterity, which refers to pad-to-pad contact, provides efficient control of the object with shift, rotation, and translation skills. In-hand manipulation is a separate skill from the gross motor grasp and release skill associated with manual dexterity. In-hand manipulation, or IHM, is the adjustment of an object within the hand between finger pads for optimal orientation after grasp. It plays a major role in fine motor skills in activities of daily living, including work and play. In the field, we refer to this as reach, grasp, control, and release, or RGCR. I am going to refer to the 1990 classification described by Exner. In 2018, in an article by Clemento et al., these definitions were amended. Please note highlighted terminology for greater clarification on the complexity of these skills. Shift is the ability to move an object in a linear manner with the fingertips or pads, such as repositioning the pencil in the fingers to position it for writing, or fanning playing cards in the hand. I have populated this slide and the slides going forward with examples of the specific in-hand manipulation skills. Rotation is the ability to turn an object around in the pads of the fingers and thumb. Simple rotation, where an object is rolled between the pads of the finger. Complex rotation, where the object is turned 180 degrees to 360 degrees, and the action requires independent movements of the finger and thumb, pad to pad. Translation is the ability to move objects from the fingertips or pads to the palm, or the palm to the fingertips or pad. This is sometimes referred to as squirreling. Some examples are moving coins from the palm to the fingertips to place into a vending machine, or picking up pills or pennies and moving them from the fingertips into the palm or into your mouth. Ulnar stabilization is an observable skill where the components of in-hand manipulation, shift, rotation, and translation can be performed while simultaneously holding several objects in the ulnar fist and manipulating an object to and from the radial side of the hand. The radial fingers produce the fine motor manipulation. It can be observed that another component of efficient in-hand manipulation is the role of the wrist, which positions the hand in space distally. The dart thrower's motion, or functional oblique, is a plane of motion in which the wrist moves in a functional oblique plane, specifically from radial extension to ulnar flexion. More recently, in 2022, research by Nadim on functional motion envelope, published in the Journal of Hand Surgery, characterized 22 modern ADLs in healthy adults. Note that 54% were in ulnar extension. As we know, our fundamental working knowledge of the neuromuscular skeletal system aids our professional assessment in client-centered treatment. We know that proximal stability is needed for distal control in the kinetic chain. The radial hand, innervated by the median nerve, is the eyes of the hand. The ulnar hand, innervated by the ulnar nerve, is where the strength of the hand comes from. And the wrist, which is mainly innervated by the radial nerve, accurately positions the hand in space. The primary muscles involved in shift and produces efficient control are the intrinsics, where the MCP flexes along with the lumbricals, as well as the intrinsics and extrinsics, which produce IP flexion and extension, and then in combination with the thenar triad. Muscles involved in rotation are the interossei, lumbricals, and thenar triad again. But let's take a look at the task of eating a healthy snack and analyze what muscles are being used. As you bring the snack towards the palm, it involves composite flexion and compression, whereas the coordination of muscles which bring the snack away from the palm to the fingertips or pads in order to precisely place the snack into the mouth are a combination of extrinsic and intrinsics. The hand is involved with flex. You will see flexor tendon glide into a half hook and then active lumbrical extension with thenar muscles. As we know, mechanoreceptors in the hand and wrist can affect the coordination of muscles through proprioceptive feedback loops. This basic science reinforces our rationale for early intervention. In 2016, the research of the role and integration of wrist proprioception by Haggart et al. Now adds to the sensory integration theory of neuromuscular stability and rehabilitation. Note the density of dorsal capsule sensory organ innervation in comparison to the volar wrist capsule in this diagram. And of course, eye-hand coordination is very important to the sequence of look, reach, grasp, control, and release. Eye-hand coordination is a huge topic beyond the scope of this presentation. But I do want to reinforce that vision provides critical predictive information for feed-forward processing of object coordinates in space, such as the object identification, weight, texture, which is transformed into upper extremity movement and hand pre-shaping to accommodate the object of desire. Here's our mascot, the homunculus. It is neuromuscular, and we are the facilitators of the recovery process. Remember to bill CPT code 97112. There are reasons for standardized and objective assessments. First, we want to provide evidence of the client's difficulties in order to plan effective intervention. It enables client-centeredness through involving client about suitable intervention. We also need objective assessment to document and monitor progress or change. This is consistent with the Choose Wisely initiative of our professional organizations. Are there specific tests for dexterity? What is our goal? To measure reportable change in the recovery of dexterity. Internationally, authors such as Law, Wang, de Klerk, and others suggest tests which are psychometrically robust should be simultaneously practical, brief, portable, low cost, and easy to administer, score, and more important, meaningful to the client. How do we evaluate in-hand manipulation? There are 3 broad categories of evaluating in-hand manipulation. We can simulate a performance, set it up for voluntary coin or pellet manipulation and placement, or provide pegboard tasks. But standardized test objects, which are usually limited to pegs or discs, represent only a small subset of geometric and material properties that are manipulated in daily life. For the purpose of this presentation, I have provided a table of dexterity tests which have been reviewed and compared in the literature in the past 13 years. Here is the legend to illuminate the following table. Please note the distinction between fine motor dexterity test and manual dexterity test. As you can see, the most popular tests of the established psychometrically robust tests are the Purdue pegboard test, the Jebsen hand function test, the 9-hole pegboard test, and the functional dexterity test, as seen by these authors in 6 articles. Recently, our Canadian colleagues analyzed the hand function and dexterity tests and separated them into 2 categories and added another criteria for hand function or dexterity test selection. Performance-based outcome measures of dexterity adds observable quality of performance characteristic, providing a qualitative scoring system. I reflected on the available dexterity tests in my clinic and noted a gap in standardized assessment for measuring and observing the in-hand manipulation skill of translation. I developed the Corbett Targeted Coin Test that approaches the problem of reporting consistently performance-based standardized assessment of palm to finger tip translation with ulnar stabilization and wrist functional oblique motion of small handheld control objects. I was able to conduct a pilot feasibility study in my clinic. Click below to view Corbett Targeted Coin Test instructions. In a convenience sample of a hand-injured population, their time and performance scores were compared with follow-up correlating test scores. The percentage of change calculation indicated incremental progress towards the unaffected hand's baseline time and performance scores. In my pilot study, I found an average of 15% change in decreasing time, reflecting an increase in speed of task. I also found an average of 68% improvement of palm to fingertip translation and accurate placement or quality of performance scores in my pilot feasibility study, which won Best Poster at 2017 ASHT annual conference, I found that in a non-injured sample of 20 to 30-year-olds, there was a 1-second difference in the speed of the task between dominant and non-dominant hands. Analysis of the quality of performance or accuracy data reflected that 1.5 coins dropped were by dominant hand and 1.7 coins were dropped by non-dominant hand. In 2020, I collaborated with occupational therapy doctoral candidates research group, and to date, one study confirmed that in that age band of 20 to 30-year-olds, 1.3 to 1.6 coins were dropped. Another research group produced norms for quality of performance or accuracy, which found an average difference of 2 seconds between dominant and non-dominant hand scores in the 20 to 30-year-old age band. In this adapted table by the Grand Valley State University Research Group, which compares favored dexterity tests with the Corbett Targeted Coin Test, it demonstrates the gap in dexterity tools is filled by the Corbett Targeted Coin Test. Summarily, Duff and Aaron also noted in their article that in coin manipulation from palm to fingertip, all 3 in-hand manipulation skills can be observed. Palm to pad translation of the coin, then shift when coin moves across finger pads, and complex rotation is observed when the coin is turned on its axis with finger pads before placement into slot. I have constructed a flowchart for your consideration of the Corbett Targeted Coin Test in a clinic setting. I would like to take you through several hypothetical implementations of the Corbett Targeted Coin Test after referral for therapy, orthosis evaluation and distribution process, as well as in-clinic treatment drills for specific diagnostic groups. In the first scenario, the patient is referred for evaluate and treat. Upon initial evaluation, the Corbett Targeted Coin Test is used for baseline measurement. Please follow the green line. In the event that the patient cannot meet participation criteria, simply state unable and describe their physical deficits. The patient is then provided conventional hands-on therapy, and in a couple of weeks, the Corbett Targeted Coin Test is repeated. The percentage of change in scores are calculated and analyzed. If it is determined that the patient has a score equal to or greater than 80% of the unaffected hand baseline score, then recovery of essential in-hand manipulation goal has been met, and the patient is preparing for discharge. Or, if a percentage of change exhibits only incremental progress towards a goal of 80% of unaffected hand baseline score, this reflects need for continuation of skilled care in recovery of essential in-hand manipulation skills. This may require a new script and new insurance authorization for continuation of skilled care. On the red line of this flowchart, consider the pre-thumb CMC arthroplasty referral for prehabilitation. It may be helpful to the patient to experience the challenge of the Corbett Targeted Coin Test before, after surgery, and then 3 months post-surgery. In another common scenario, the patient is referred for an orthosis evaluation and distribution. Please follow the red line in the flowchart. A prefabricated orthosis can be provided. Proper fit and adjustment can be determined with the use of the Corbett Targeted Coin Test. The same can be done with custom orthoses, which need to exhibit proper fit after multiple adjustments. And then the application of kinesio tape can also be determined for its effectiveness. I have provided a 4-minute video at the end of this presentation of these clinic scenarios with the use of the Corbett Targeted Coin Test. But I would also like to share with you the clever feedback from the therapists. Please see the blue line in the flowchart, who use the Corbett Targeted Coin Test for treatment drills without test biasing. By simply turning the box around, using the right hand lid with the left hand and vice versa, or rotating it or placing the unit on its side, the Corbett Targeted Coin Test appears to be a versatile adjunct to in-hand manipulation drills in the clinic. I look forward to any questions and or videos you want to share with me at julie@targetedcointest.com. I am confident that you will find the Corbett Targeted Coin Test cost-effective, convenient, cleanable, and consistent. Thank you for the privilege of presenting this material to you today.